Hello humans. My name is Nex. Welcome to our talk today about a truly important topic. Human, please take it away.
Thank you, Nex. And welcome to AI Innovations Unleashed. This is the show that explores the latest in technology and health and how they're reshaping our world. I'm your human host, JR, and in today's episode, we're diving into a topic that's been gaining a lot of attention lately: AI and mental health. From chatbots to virtual therapists, AI has the potential to revolutionize the way we diagnose, monitor, and treat mental health conditions. But can artificial intelligence ever truly replace human empathy, or will it become an invaluable ally in mental health care? Let's dive in. Mental health is a topic that affects millions of people worldwide. In fact, according to the World Health Organization, 1 in 4 people will experience some form of mental health disorder during their lifetime. Conditions like depression, anxiety, and PTSD have become more prevalent, and as we struggle to address these challenges, AI is stepping in to offer new solution. Let's first explore how AI is making an impact in diagnosing mental health issues. AI is already being used to help diagnose mental health conditions, and the results are promising. Machine learning algorithms can analyze speech patterns, facial expressions, and even social media activity to detect early signs of conditions like depression or anxiety. For example, studies have shown that AI can identify patterns in a person's voice that may indicate depression, even before they have self identified or sought professional help. A 2021 study published in the Lancet Psychiatry found that AI models could accurately predict which patients were at risk of suicide based on their social media post. This is significant because early intervention can often prevent more severe outcomes. Similarly, AI systems are helping doctors diagnose conditions like PTSD by analyzing patterns in brain scans or behavioral data. These AI driven tools don't replace the role of a mental health professional, but instead assist them by providing an extra layer of insight, leading to faster and more accurate diagnosis. But AI just isn't helping with diagnosis. It's also playing a role in monitoring mental health care conditions. Let's look at one of the most interesting developments in this area: AI powered chatbots. You may have heard of AI chatbots like Wobot or Wysa. These virtual assistants use natural language processing to engage in real time conversations with users, providing mental health support. Wobot, for example, helps users work through negative emotions by teaching cognitive behavioral therapy techniques in a way that feels personal and non judgmental. A recent study published in JMIR Mental Health found that people who interacted with Wobot for just 2 weeks reported a significant reduction in symptoms of depression and anxiety. These chatbots can be available 24/7, providing immediate support to anyone who needs it, especially when a human therapist is unavailable. What's particularly interesting is that these AI tools are diagnosed to be scalable. For all its benefits, traditional therapy is limited by availability and cost, but AI chatbots can be used by anyone, anywhere, at any time, making mental health support more accessible, especially in underserved areas or for people who might otherwise not seek help. And it's not just about diagnosis and support. AI is also helping to treat mental health conditions. Virtual therapists powered by AI are offering new ways to administer psychotherapy, particularly for people who might feel uncomfortable with in person sessions or those who face barriers to accessing therapy. For instance, AI systems like Tess and Replica provide virtual therapy through text and voice interactions. Tess, an AI based system, has been shown in several studies to be effective in treating people with depression and anxiety. To create tailored treatment plans, Tess uses a blend of personalized therapeutic techniques based on principles from cognitive behavioral therapy, mindfulness, and dialectical behavior therapy. A 2022 study published in Psychiatric Research showed that patients who used the Test app experienced a reduction in depressive symptoms comparable to that of people undergoing traditional talk therapy. But can AI replace human therapists? That's a question worth asking. While AI can be incredibly effective in helping people with certain therapeutic techniques, it's important to consider the role of human empathy. Human empathy is a fundamental aspect of mental health care. AI has a long way to go before replicating the complex emotional connection a human therapist provides. Empathy, the ability to understand and share another's feelings, is essential to building trust, offering comfort, and facilitating meaningful change in therapy. But AI isn't trying to replace empathy, it's designed to complement it. Think of AI as an assistant to the therapist rather than a replacement. For example, AI can help monitor a patient's progress between sessions, offer timely support during moments of crisis, or provide therapeutic exercises to enhance traditional therapy. Virtual therapists may be able to offer interventions at any time. However, human therapists are still critical when understanding the nuances of a person's emotional state and offering the warmth that comes from genuine human interaction. It's about balance. In the future, we may see a combination of AI and human therapy that ensures a more accessible, efficient, and comprehensive approach to mental health care. To wrap up, AI is making waves in the mental health field, and the potential is enormous. From improving diagnosis and providing on demand support through chatbots to delivering personalized therapy, AI is helping to break down the barriers many people face regarding mental health care. At the same time, it's clear that human empathy will remain an irreplaceable part of the therapeutic process. AI might never replace the emotional connection between a patient and a therapist. Still, it can enhance how we approach mental health care, making it more accessible, personalized, and effective. The future of therapy might not be AI or human. It's likely going to be a hybrid where both work together to provide the best possible care. So, could AI eventually become a trusted ally in mental health care? The answer is yes, but it's a partnership, not a replacement. And that's all for today's episode of AI Innovations Unleashed. Thank you for joining me as we explored the future of mental health care in the age of AI. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with your friends. As always, if you or someone you know is struggling with mental health, please reach out for professional support. AI or no AI, human connection matters. And if you need help finding additional resources, visit the National Institute of Mental Health website. There are lots of resources available free of charge, and I'll post the link down below. So, take care of yourself and each other. Until next time, stay informed, stay engaged, and see you next time.